Kidney failure cases are rising at an alarming pace here in Singapore, and the National Kidney Foundation is now warning of what it calls a kidney tsunami. 6 people are now diagnosed every day. That's a threefold increase from 2 decades ago. With 600 new dialysis patients every year, the NKF wants to ramp up home-based dialysis instead of treatment at its centres. Sherlyn Xia has more.
70-year-old Yusuf is a dialysis patient, but the routine only needs him to connect a tube to the abdomen. A special fluid enters his belly to flush out impurities while sleeping.
I'm like a robot, nighttime I'm charging myself. Daytime I'm fully charged, I can walk around.
Peritoneal dialysis, or PD, can be done in the comfort of one's home. It's unlike conventional hemodialysis, which requires a machine at a centre to remove toxins from blood 3 times a week for a few hours. But with kidney failure cases rising more quickly because of aging or diabetes, it's estimated 5 such centres need to be built every year. That number is not sustainable, according to the NKF, which cares for a majority of dialysis patients in the country.
We are seeing about 100 applications a month, and that is of a grave concern that we see must be addressed. And we can't keep on providing space, neither can the hospitals cope. So I think prevention is very important, but that is a long-term goal. In the short term, we need to provide accessible care for the people with renal failure.
To cope, the NKF is aiming to get more kidney dialysis patients on PD. While most can take up this option, an assessment of the medical condition, social support and lifestyle is still needed. The NKF's move is also what the government is calling for. The Health Ministry is now pushing for a peritoneal dialysis preferred approach. It's aiming to get 30% of new dialysis patients to opt for PD by 2025, up from the current rate of 20%. The NKF is beefing up its PD community support program, where nurses make regular home visits to check on patients. It's also working with Khoo Teck Puat Hospital to give care for dialysis patients under the NKF. More resources are also going into the week-long training sessions for PD patients.
Peritoneal requires more home support and self-care or independence by the patients. And this is where it takes a bit longer, but once they are comfortable with the treatment, in a longer term basis, they have more flexibility as compared to hemodialysis.
The foundation is also working with the Health Ministry to develop more pre-dialysis counselling, training and education materials.